Welcome to Miami Lead, a podcast dedicated to equipping leaders to face today's challenges with courage, faith, and innovation. This series is designed for anyone wanting to grow as a leader. Each episode offers insights, strategies, and inspiration from some of Miami's most influential minds. Our goal is to help you lead with purpose, build meaningful connections, and have a lasting impact on your community. We're glad you're here, because everybody wins when a leader gets better. And now, Pastor Bill White.
I'm very excited to get to welcome not only an outstanding leader and professional, but a gentleman that I've been blessed, really privileged to have friendship with for several years. And what a privilege to have you here with us today, Bo. And looking forward to that. To those that are joining us on the podcast today, I really want to welcome you and invite you to remember with me that Miami Lead is our opportunity to not only feature some local success stories. It's one thing to succeed, it's another thing to do it in Miami. And what we do in this gathered space is an opportunity to listen to leaders that are in the process of rising, and then as that tide rises, other ships can rise with it. And today, very pleased to have Bo Boulenger with us from Baptist Health, President and CEO of Baptist Health System, the largest healthcare organization in all of South Florida, one of the largest in the nation, not-for-profit systems in the nation. 12 hospitals, over 28,000 employees, 4,000 physicians, 200 outpatient centers, urgent care physician practices. The footprint of Baptist Health goes from Palm Beach all the way to Key West. And so, I'm kind of catching my breath just remembering this with our audience today. But story of incredible success, and I haven't even mentioned the honors and the accolades and the third-party recognition that has come their way, like what? Like Fortune magazine rating Baptist Health as one of the 100 best companies to work for in America, now 2 decades running. So, if you're wondering, what is Miami Lead? It's an opportunity to let leaders gather, be sharpened by one another's insights, to have a nice lunch and learn together, and then see about what value we can take with us to add to the community of service where we lead. And so one of the things we say around here is that everybody wins when a leader gets better. Yep. And that came from the Global Leadership Summit, which when we first brought it to town, I came to your office at Baptist Hospital, I'm remembering, Bo, and just said, hey, here's a set of CDs or DVDs. What was it at that time? I'm not sure which technology we were in, but I said, do you think this is something?
Yeah, it might have been a VCR tape at the time. But yeah, we were some of the early supporters of bringing the Global Leadership Conference to Miami.
And then I guess it's been like 12 or 13 years that we've partnered in bringing the Global Leadership Summit, and then Miami Lead grew out of that. Could we take a slice of the summit leadership of this brackish space of marketplace and ministry leadership and then learn from one another throughout the year? And so thank you for being part of its beginning and now in your assistance today for this. Baptist Health is in so many ways a phenomenal success story. So that's all I want to tee up. I want to say, bring us into that. I mean, you've served now as CEO there how long?
About 2 years. But I've been with the organization for 39 and a half, but who's counting? I actually found my personnel file the other day from when I was an administrative resident at South Miami Hospital, August 1985, offering me the job.
Yeah.
$14,200, by the way.
Yeah. Well, and now, I was looking over the introductory comments that I could have potentially made, and I summarized it a lot, but I would love for you to take us into what is the organization that you are now charged to oversee and to lead? Tell us a little bit about that.
Oh, Bill, overjoyed to be able to do that. Let me first just say what a pleasure it is to be here with you. Bill has been a friend, a mentor, a North Star of mine for so many years. I would observe him being on the boards and providing just the right insight or inspiration during difficult conversations, and we appreciate that so much and enjoy it so much. And I'm sure you, like me, I'm a student of people that give talks or speeches because it's not easy. And Bill is so amazingly talented at it. I frequently take notes when Bill is speaking and try to learn from Bill. Wow. And it's so easy to be able to talk about a place that you love and a place that you spent your whole career. So if you'll bear with me, I will just give you a little overview of Baptist Health South Florida so that we set the table for future conversations about the context of things we might talk about within that. So as you heard from Bill, we're at 12, we're now, this moment in time, we're a 12 hospital, faith-based, not-for-profit system. We are headquartered right here in Coral Gables, so we're not a company that's from out of town. We've got 200 outpatient locations, 4,000 doctors, 18,500 employees. We're Miami's largest private employer. And we've got about $6.2 billion in annual revenue. So those numbers are important because healthcare is getting more and more challenging of an environment. So being large gives you the size and scale and the liquidity to be able to do things that you would want to do and investments that you would want to make that standalone hospitals, which there are very few any longer, would really struggle to do. And as you mentioned, we take care of people all the way from northern Palm Beach County. We're building a large freestanding emergency department in Wellington, all the way down into Broward. We've got integrated care centers in Broward to bring all these medical specialties to people closer to where they live. We're building a new hospital in Sunrise. You may have seen that in the South Florida Business Journal. All the way down, Homestead Hospital, which we'll probably talk about later. It has struggled since Hurricane Andrew. We maintain a very charitable involvement in Homestead and keep that thing going all the way down into the Keys. And we do things like in Key West, the local cancer provider just went out of business. So we're bringing oncology and chemo and radiation therapy back to Key West so the 45,000 people that live down there don't have to travel up. And so that's the basic framework of the organization. Within that framework, we've made a very conscious decision to try to, I did want to mention there are 4 systems like us in the state of Florida. One in Tampa, Baycare, 2 in Orlando, Advent, and Orlando Health, and us. And so we're the only really large not-for-profit system in South Florida. We've made a very deliberate move into developing centers of excellence. So the idea is none of us would ever feel like we have to leave Miami for extraordinary care. The latest research, the best doctors, the experience that all of us want. And what we've learned over the years is you need to get care where your support network is, and your support network is at home. So you really don't need, and you and I have had friends that have left for cancer care, for example, and not had their support network around them. So we're building out institutes really around the large, what might ail us going forward. You know, the largest cause of disease in the United States or worldwide is heart and vascular disease. So we have a robust heart and vascular institute. We've hired a bunch of really top-notch young doctors that specialize in doing valves. We're now doing more heart surgeries in Miami than anybody else. Next is cancer. And we recruited the greatest leader, Dr. Zinner, you had him on not too long ago, to run our Cancer Institute. 2,000 patients a day at the Miami Cancer Institute. They've already outgrown in 7 years a building that we thought we had built capacity into, and thanks to philanthropy, we're building a women's center because a third of what we see in the Cancer Institute is breast cancer and women's gynecological cancer. So we need to invest in that. We have a neuroscience institute because what are we all afraid of? Strokes, Parkinson's, dementia, Alzheimer's. And there's not enough research, not enough caregivers in the community to treat those conditions and brain cancers. So we've got a wonderful institute under Dr. McDermott for neuroscience, and then finally orthopedic and sports medicine, because I don't know about you, but Bill's a little bit of a weekend warrior, so am I. We want to keep going. We want to keep those knees and shoulders and hips limber. And we take care of every pro sports team in Miami except for the Marlins. And so you probably want to go where the pros go, even though we're weekend warriors. So we have those 4 institutes. And then finally, we made another very deliberate evolution at Baptist Health, and that is to add academics to our mission statement and to become a teaching hospital at Baptist Hospital. So Baptist Hospital is going to become a statutory teaching hospital. So Miami will have another great major teaching hospital. We partnered with the largest public university in Miami, FIU, who's really on a roll. I mean, they're really doing extraordinary things at FIU. We're building out 16 residency programs. In 5 years, we'll graduate 300 residents and fellows a year. And it's been proven that people tend to stay where you do your residency. So that will add more doctors for us here in South Florida as well. So those are just that's a snapshot of who we are and how we're structured and a nutshell of some of the things that have evolved over the course of the last couple of years.
Phenomenal success story.
Thank you.
And thank you for being here with us to help us understand it. From the beginning, though, I did understand this out of, maybe it was Arthur Vining Davis that said, I want to be sure there's a pineapple out front. Can you tell us a little bit about the pineapple icon or the logo and what that means within the system?
Absolutely. So one of the founders of Baptist Hospital of Miami is Arthur Vining Davis, and he was co-chair of Alcoa Aluminum, retired to Miami in his 80s, but he loved Miami. In fact, he owned most of the land in Kendall, where the Palmetto is, Dadeland, and he was a big supporter of the Miami Baptist Church that wanted to build a hospital, and that's kind of him and $1 million gift and a 40-acre gift is why Baptist Hospital is on Kendall Drive. It was called the Road to Nowhere back then, and it was all farming. Janet Reno lived nearby. She'd write pictures in the lobby of her riding horses on the Baptist Hospital campus. So that's kind of our origin story. And we hit upon the idea of the pineapple because it dates back to medieval times as a universal symbol of being welcoming. Sometimes you'll see it in Europe carved into doors or doorways, and because people would take people in. And it's a universal symbol of hospitality and welcoming, so we're proud to have it as a very visible expression
I see
of
you got
what
a
we're all
pineapple
about.
on your lapel right there.
Yeah, exactly.
Should have served up some pineapple today.
We should have. I should have brought some.
What was I thinking?
And you know, they used to grow pineapple out on Elliott Key and ship it up north.
I did not know that.
Because of our favorable weather.
Yeah, yeah. Well, speaking of hospitality and caregiving, you've been with Baptist Health, as you said, for decades, CEO at Homestead Hospital, CEO at Baptist Hospital, where I had the privilege of coming into a closer circle with you, CEO now for the entire system. And so you've had leadership at several levels within the culture of what Baptist is, which, by the way, even the word Baptist came from that partnership between C. Roy Angel and Arthur Vining Davis. C. Roy Angel was an outstanding known Baptist pastor from Central Baptist Church at that time, and then they got together and helped this thing begin. So, but what would you say are your ideas on what, if you were to try to explain some of the success secrets, what the secret sauce is sometimes we talk about when it comes to the kind of consistent strength and the leadership that defines Baptist Health?
I'd be happy to take that on. I would say it is purpose, it's mission, and it's culture. So our purpose is really baked into our mission statement, who we are. We're a faith-based not-for-profit, here to take care of people in their best and in their worst moments. And we try to hire nice people who will try, and we tell them that during orientation. You're probably really good at what you do,
somewhere else.
But we want you to be nice too. That's really important. Be nice and be welcoming, because people are coming here afraid. And so when you have motivated employees that have this sense of purpose, and we tell them, we hope that this is the place where you can be your best every day. And please bring that to work with you. We will provide the latest equipment, beautiful facilities, and we want you to absolutely be your best. So we have people that are hopefully showing up to work every day, highly motivated to do a great job of taking care of others. And as you mentioned, we've been blessed to be named by Fortune 100 the last 23 years in a row as one of the top 100 companies to work for in the United States, and recently named as the top healthcare employer in the state of Florida. And even with COVID and the challenges of COVID, right now we only have a 4% nurse vacancy rate. So the fundamentals are solid, the core culture is solid. It requires constant re-nourishing as a leader and talking about culture and talking about the importance of people and of culture. But you know, that is the secret sauce, that is the glue that kind of holds everything together at Baptist. And then I would also add to that, we're able to, because we're a community-based not-for-profit, we're able to take a long-term view. Every one of our facilities is hurricane hardened. You know, we're not cutting any corners. We're taking the long-term view, investing in facilities, investing in people, because, you know, we're not going anywhere.
How do you, I mean, you said we're going to refresh culture regularly. That's where I want to go next. It's just like, let's tee it up, say, how do you do that? How do you build values into the staff? It's one thing to hire people. It's another thing to see that they're nice.
Yeah.
And then to help them know how to do what it is that defines you as a culture. You got anything there? And then maybe on the heels of that one, we can say, and what are some standout moments that may have demonstrated the kind of culture that made you think, yeah, now that's us. That's who we are.
I think if you've got a good culture, you need to talk about it. And you talk about it frequently and embrace it and let everybody know it is something to be protected and something to be guarded. So when we interview people, we talk about culture. When we orient them, we talk about culture. We meet with all the leaders 2 or 3 times a year. We always do a culture refresh with everyone. At the last one, we reminded everyone mission, vision, and values, and paused on each value.
So there's the petri dish for culture. Mission, vision,
and values. And make sure everybody in the organization knows what your mission, your vision, and your values are, and to try to live those every day and reward people for living the values and lift them up and celebrate people that, you know, on a daily basis, live the values.
Yeah.
And it's not so easy because, you know, after COVID, we've had a turnover of folks, and some more senior people. COVID was a very traumatic experience, and a number of people said, "I've done my duty," and we have provided scholarships to all these young people to come and work for us. A third of our workforce is now been with us for less than 5 years. So you've got to work on all of those people. We just did a whole town halls with everybody and a whole mapping of who we are, where we came from, what's our culture, to bring them along. And we try to talk to all the leaders that have been here more than 5 years about it's your job to bring along the young people and to talk to them about the importance of culture and the Baptist way, which is always do the right thing no matter what.
That sounds like a value worth holding.
Yeah.
And as you're saying that, I'm thinking about our culture here, even within our faith-based not-for-profit organization, a church that seeks to honor and follow Jesus. Our purpose statement is we help people find and follow Christ. And then we seek to express our values. We've got them on the wall around here, just so we take a strong look at them regularly. But what you said was you bring on people that you want to help reproduce that in the others that are serving with them and under them. And I thought, okay, well, and what we talk about is, well, we want our staff to model it. We want our leaders to model the values, vision, and behavior. We want them to mentor others in the process. And then we want them to multiply that so that it spreads throughout the community that we're trying to create. So yeah. I'm patting myself on the back here for saying I'm like our Baptist health system.
It's not rocket science, but it requires a lot of discipline to always be doing it, to always be refreshing and invigorating and talking about it. And I don't know about your experience, but our experience is people respond really well to it. I'm sure people are drawn to the ministry the same way they're drawn to healthcare, and they really just want a place where they can be their best and to do what they're passionate about.
So one of the things that we are committed to is thinking 2 generations down, not to the ones that are in the driver's seat now, but to the ones that are coming from the back seat, front seat, driver's seat. And how do we help younger leaders, generations rise? And I know that that's been a part of your priority as well. And you already mentioned that a third of the current employed staff are hired within the last 5 years. I also know that half of the employees are millennials.
Yep.
That's a whole generational shift. And so what I'm wondering is, and we have a host of young people that connect with us at the Global Leadership Summit and then also at Miami Lead. And so I'm just wondering, what do you tell young people about a career in healthcare and the opportunities that exist there? And maybe there's some transferable principle that we can take to our workplaces as well.
Be happy to talk about that. This is a really easy one for me because I have 4 millennials at home. Some have said they've left, but they're kind of in and out, right? As that happens, and we always welcome them back. And one wants to work in healthcare, so I've had a chance to practice this. What I tell them all the time, or what I tell young people at Baptist Health is, number one, make sure this is your passion. Follow your passion. You will be so invigorated and have so much more energy if you are following your passion. And it's very clear to a lot of people that healthcare is absolutely their passion. They just need to find the right place to do it. And then I'll tell young people, this is a journey. Career is a journey, leadership is a journey. Be a lifelong learner. I have embraced the concept of being a lifelong learner. Always more to learn. You can always improve yourself and improve your skills. And healthcare is constantly changing. It's very complex. You've got to commit yourself to being a lifelong learner. I also ask them to try to be patient with themselves and with other people, because it takes a while to get to a position where you can achieve the level of self-gratification that you want from your work. The first couple of years, maybe not so much. And healthcare is so complex. I think with Jim Collins, it says it's the most complex industry in America. It literally takes you 5 or 7 years to kind of figure out all the pieces and how it all fits together. So be patient with others and be patient with yourself.
Find your passion. Be a lifelong learner.
Lifelong learner and be patient.
Give yourself time, persevere, hang in there.
Exactly.
All right.
And whatever education or additional training you feel like you might need, you want to pursue that.
Yeah. I know that you're in your passion, but how did you find your passion?
Well, I'm one of those really rare people. Find myself just always counting my blessings, how lucky I am. My father was a hospital administrator. He was drafted into the Army, World War II, medic in the European operating theater, World War II, Battle of the Bulge, major battles. He came back to the United States with PTSD and kind of confused about what he wanted to do. Surgeon he was with in Europe said, look into this thing called hospital administration. We need professional managers for hospitals that have been historically run by nurses. And so he did that. And I had the advantage of growing up in a household with him, he was working all the time, as people in that generation tended to do. So I'd round with him. If I wanted to see him, I'd go in with him on the weekends and walk around the hospital. Saw how he talked to people, the janitor, the doctors. He'd bring home doctors and nurses to help solve problems. Of course, they were smoking cigarettes, and drinking scotch while they were solving the problems. But again, different era. But I got to experience this, and it's all I ever wanted to do was to be around a hospital. We would move to different towns, and we would be trying to make that town better and the lives of the people in that town better. So I said, I'm drawn to business, purposeful work, fascinated by hospitals and doctors and nurses is all I've ever wanted to do. So I'm absolutely blessed. I've told Bill this, all I ever wanted to do was run one hospital. So I am over the moon that I get an opportunity to lead, along with my colleagues, really one of the nation's greatest healthcare systems.
Amen. My boss has a line about that. He says, if you're faithful in the little things, then you will be entrusted with the greater things. And so there's something there about, sometimes I think dads might feel like they're being ignored or neglected, and they don't know if they're having impact on their children or their sons. But what an encouraging reminder that you just live your life, speak into your passion, and maybe you'll see your dream come true as well.
Absolutely.
So,
and the impact we have on everybody's lives, whether we feel like they're listening or not.
Speaking of impact, I know that the purpose statement of Baptist Health says that it is a faith-based organization that is guided by the Spirit of Jesus Christ and the Judeo-Christian ethic. And I just wonder, before, I've got one more question after this, but how do you see that at work in the culture, in the office, in the employed staff? What does that look like from where you sit?
I see it every day, but I've got to be honest. If you work at a not-for-profit like Baptist Health and you don't see faith every day, you're not paying attention, because it's always there. It guides our decisions. It guides our values. It provides us with support during challenging times. And every day, my faith is invigorated by observing what people do every day in our great organization, in our great facilities. It's just so rewarding to see how they bring faith to work, and how sometimes unexplainable things happen as a result of involving faith. I'll give you a couple of examples. I go to a lot of community meetings now, and I was at a meeting of the Federal Reserve Board here in Miami, and a woman I didn't know came up to me and said, I just want to thank you. I want to thank you for how caring and compassionate the Miami Cancer Institute is. And my husband had pancreatic cancer, and how they made a very difficult experience something that was as tolerable as possible. And I told her, I'm so sorry, your husband has had pancreatic cancer. She goes, oh no, he's still alive. You know, pancreatic cancer has a 5% survival rate for 5 years. 6 years out, weighs 140 pounds, but he's still alive. You guys have been keeping my husband alive. I was not expecting to hear that, and there might be a little bit more at work here. Another example is, after a board meeting, we had a board member who was down in the ICU. You probably remember this. I think you came with me, and our chairman of the board, Calvin Babcock, said, let's go down and see this board member and pray with him. So we went down to the room. From the doorway, he was unrecognizable, like someone that I thought, in my experience around hospitals, there's no way this person, unfortunately, is coming out of the hospital. We stood around the bed. We held hands. I think the chaplain was there. His wife was there. We prayed. He came through, and he lived another 20 years. So we can't explain all these things, but we ask people to bring their faith with them to work, to meet patients and families where they are, no matter what type of faith that they have, and to make that a part of the healing process in and around our hospitals. So we see it and live it every day.
Wow. I know our time is up, but I wanted to give you a chance to say, is there anything else that you had hoped maybe you could say that I have not given you opportunity to it yet?
I wanted to express appreciation to you and all the other volunteer board members. I don't know if you all know this or not, but Bill is the former chairman of the board of Baptist Health. You get a lot of phone calls when you're the chairman of the board of Baptist Health. And him and Lisa.
This isn't exactly what I was thinking you were going to talk about.
Navigated through that, but this is my opportunity. You gave me the mic. So I wanted to thank you and thank all of our other volunteer board members who serve without compensation and provide an extraordinary level of insightful leadership to our organization, which makes our leadership makes our organization better and stronger, and is also an important part of the secret sauce. So thank you.
Thank you so much, Bo. Would you say thank you with me to Bo Boulenger for his comments today? What a privilege.
Thank you.
Thanks for listening to this episode of Miami Lead. Colossians 3:23 says, "Do everything as for the Lord." No matter your position, God wants you to lead in a way that honors Him. If you enjoyed the conversation, remember to follow the channel and turn on the notifications so you never miss an episode. If you'd like to be a part of our live audience for future recordings, head over to miamilead.org to learn more and register. We'd love to see you there. Remember, everybody wins when a leader gets better.